Hello everyone, my name is Liam Del Bosco, and today I'll be presenting my special cancer project, Hodgkin's lymphoma. So, what is Hodgkin's lymphoma exactly? Well, Hodgkin's lymphoma, which is also known as Hodgkin's disease, is one of the main types of lymphoma cancer, typically developing in the lymph system. The lymph system is part of the immune system, which means that protects your body from infections and disease. There are two main types: classic Hodgkin's lymphoma and nodular lymphocyte predominant Hodgkin's lymphoma. The former, which is classic Hodgkin's lymphoma, being the most common. In classic Hodgkin's lymphoma, several subtypes include nodular sclerosis Hodgkin's lymphoma, which is the most common in this main type, as well as mixed cellularity Hodgkin lymphoma. Now, Hodgkin's lymphoma is a relatively rare form of cancer, with about 8,000 new cases each year in the US. It is most commonly diagnosed in males with a bimodal age distribution, occurring between the ages of 15 to 35, and then again in people over 55 years of age. Now, what are the risk factors? Risk factors includes people with HIV, a past history of Epstein-Barr virus infections, autoimmune disorders, and also family history increases the risk of Hodgkin's lymphoma. The highest incidence rate was reported in Southern Europe with a 2.8%. Around 23,400 deaths, so almost reaching 23,400 deaths, were reported globally in 2020. When detected early, Hodgkin's lymphoma has a high rate of survival at approximately 90% of the cases. That is, when detected early. Now, what are the symptoms to Hodgkin's lymphoma? Well, the main symptom to look out for are painless, swollen lymph nodes on the neck, armpits, and the groin. Other symptoms, usually called B symptoms, that will help determine the stage and outlook of cancer are intense night sweats, fever that comes and goes without an apparent infection that lasts over the course of several weeks. Other symptoms that seem unrelated are itching of the skin, fatigue, and unintentional weight loss. For Hodgkin's lymphoma that affects the chest, the swollen nodes may press against the windpipes, causing a shortness of breath. Now, after the onset of symptoms, the first step towards diagnosis is a medical examination. To confirm the diagnosis, a biopsy of the swollen lymph node will determine the presence of Reed-Sternberg cells. Imaging, such as CT and PET scans, will help determine the cancer stage and spread of the disease. Now, we will talk about the genes and pathways that are responsible for this cancer. One of the primary pathways in Hodgkin's lymphoma is the NF-kappa B pathway. This pathway allows for cells to survive, and in this cancer it is overactive, which prevents the cancer cells from dying, resulting in persistent activation. Mutations in the IKBA gene act as a cellular brake, preventing the NF-kappa B from activating genes that will provide an immune response. In about 40% of classic Hodgkin's lymphoma, the Epstein-Barr virus cases contribute to the NF-kappa B activation. Now, to put into context as to what the previously mentioned Reed-Sternberg cells are, these cells are large multinucleated cells. These cells are large multinucleated abnormal B lymphocytes that release signaling molecules called cytokines, which attract other immune cells. This then results in the creation of the tumor environment that can be observed in Hodgkin's lymphoma. Now, the Hodgkin's lymphoma cells can avoid the immune system by using the PD-1 or the PDL-1 pathway, allowing them to hide from immune attacks. This is the target for therapy of the disease, which we will get to in a moment. Now, what are the treatments to Hodgkin's lymphoma? Treatment typically includes chemotherapy, radiation, and immunotherapy. And in some cases, there's even a combination. A combination of these can be utilized. Depending on the stage and response to the treatments, some patients may benefit from a stem cell transplant. As mentioned earlier, the PD-1 or PDL-1 is a pathway used by Hodgkin's lymphoma cells in order to avoid attacks from the immune system. New immunotherapy drugs, such as Keytruda, are PD-1 inhibitors, which allows T cells to recognize and kill cancer cells. This treatment has fewer side effects than chemotherapy, and it is often used on refractory cases of Hodgkin's lymphoma, which means that other treatments typically stop working. Here are my references. This is the first page. And here is the second page. Thank you so much for listening to my presentation. If you have any questions, please let me know. Otherwise, thank you so much, and this is my presentation on Hodgkin's lymphoma.